In this segment of the Medicare Made Simple series, we're going to discuss the difference between Medicare Supplement and Medicare Advantage plans and how to choose the best plan for you. Well, my name is John DeShaw, and I'm a financial advisor with Solera Asset Managers and Insurance Agency. We're located in Roseville, California, just outside Sacramento. We're a local, independent financial services office. I've completed the American Healthcare Insurance Professional Certification, and I'm certified to offer both Medicare Advantage and Medicare Supplement plans. I'm licensed, contracted, and appointed with several of the major national and regional carriers of Medicare plans in California and several other states so that I can offer my clients several solutions when it comes to making this decision. But first, for compliance purposes, we must inform you that this course is not affiliated with, nor is it endorsed by any government agency or the federal Medicare program. It's purely for educational purposes, and there will be no offer to buy or sell any products. Each situation is unique, and you should consult with a licensed agent before making any decisions. Before we dive in, let's briefly review some basics of the government-sponsored Medicare program. There are two parts of traditional Medicare offered through the federal government, Part A and Part B. Part A is your hospital coverage. It's free if you or your spouse have been working and paying taxes for 10 years. If not, you are able to pay a monthly premium for it. Part B is your doctor or medical coverage. You will pay a monthly premium for Part B, which will change each year. You'll need to keep paying your Part B premium no matter what choices that you make. Now, once you have original Medicare Part A and Part B in place, you have two choices on how you can fill in the gaps in your Medicare coverage. They are adding a Medicare Supplement plan, also called a Medigap plan, or choosing a Medicare Advantage plan, also called Part C. It's important to understand that though these two plans do not really work together, you cannot have both of them at the same time. You will need to choose one or the other as an addition to traditional Medicare. The first choice, or option one here, is to add a Medicare Supplement plan. You may also hear this called a Medigap plan because it fills the gaps. They are the same thing. I'm going to be referring to them as Med Sups throughout this video. Now, Medicare Supplement plans are offered by private insurance companies, and as the name says, they supplement Medicare. So they are not Medicare plans in and of themselves. They help to pay some of the out-of-pocket costs that come with traditional Medicare, like deductibles and coinsurance. So do Med Sups really work? Med Sups pay after Medicare first pays its share. Your healthcare provider gives you treatment and then bills Medicare. Medicare processes the bill, and if it approves the service, it pays what it's supposed to. It then sends the remainder of the charges to your Med Sup plan to pay its share. Then any remainder, if there is any, is passed on to you. It's important to understand that Medicare decides if the claim is paid. If Medicare approves the bill, your Med Sup plan must pay its share of your deductibles, co-pays, and your coinsurance. Now, here are some of the unique features of Medicare supplements. First, Medicare supplement plans allow you to see any provider that you choose to who accepts Medicare. It doesn't matter if the doctor or hospital is contracted with the carrier. If they accept Medicare, they will also accept your Med Sup plan. Second, all new Medicare beneficiaries are given a one-time 6-month-long open enrollment window to enroll in any Medicare supplement plan offered in their area with no health questions asked, no medical underwriting. If you apply during this 6-month window, your acceptance is guaranteed. Third, you do not have to choose a primary care physician with a Medicare supplement plan. There are no referrals necessary either in order for you to see a specialist. Med Sups give you the most freedom of choice when it comes to receiving care. Fourth, Med Sups are standardized by the federal government, making them easy to compare. Each is labeled with a letter. Every plan with the same letter offers the exact same benefit, no matter what state it's offered in or no matter what insurance company is offering it. Now, this chart shows all the Med Sup plans offered today listed across the top. and the benefits they cover are listed down the left side. If you can see the level of coverage, it varies quite a bit. There are standardized plans that cover all the Medicare deductibles, co-payments, and co-insurances, while other plans leave some of those costs for you to pay on your own. For example, if you're new to Medicare in 2021, the most comprehensive plan you could buy is Plan G. The Plan G from one insurance company has exactly the same benefits as a Plan G from all the other insurance companies. This means that you can shop around based solely on the price. I know some of you are thinking, well, this chart says Plan F. It covers more than Plan G. Unfortunately, Plan F is only available to individuals who turn 65 before January 1st of 2020. Now here at Solera, we take price comparison for our clients very seriously. We not only look at the listed price, we also look at the company's standardized rate increases. This means how much they've raised their premiums as you age. Yes, all Medicare supplement plans get more expensive as you get older, and their general rate increases. Well, in general, Med Supp plans have higher premiums than Medicare Advantage plans, but the costs on the back end are very predictable. For example, if you enroll in a Plan G, the only cost you have is your Part B annual deductible, which in 2021 is $203. So you will pay the first $203 of your care, but after that, all other costs are covered. You will not have any copays, no out-of-pocket expenses other than your monthly Medicare Supplement Part B and your Part D premiums for a drug plan. So it's very easy to predict what your healthcare costs are going to be that year. In our experience, Med Supp plans work very well for people who want the freedom to choose any provider they want. People who travel often within the United States because they can see any provider anywhere as long as they accept Medicare. These plans also work very well for people who just don't want to deal with the hassle of networks. They also work great for individuals who are entering Medicare with a chronic health condition, which Medicare Advantage plans don't have a specific plan for. Or if you're a person who uses medical services often and you're worried about the costs you will encounter once you're on Medicare, then purchasing a Med Supp plan with a comprehensive coverage like a Plan G will give you peace of mind, and you'll know that you will have very little out-of-pocket costs during the year. In this case, your monthly premium really becomes your budget for your healthcare expenses. Now, one thing I want to highlight is that Med Supp plans do not include drug coverage because these plans were created before Medicare Part D plans even existed. However, it is easy to pick up an inexpensive Part D drug plan. It can cost anywhere from $7 to $20 per month to go along with your original Medicare and your Medicare supplement plan. But it is another card to carry around in your wallet and another company to deal with when it comes to billing. And some people just see that as an inconvenience. Now, the alternative to a Medicare supplement plan is option number 2 on the right, a Medicare Advantage plan, which offers another way to get your benefits. Now, these plans were introduced in the late 1990s. They are a form of coverage that you can enroll in to get your benefits from a private insurance company instead of a Medicare federal government program. Advantage plans by law offer the same services as original Medicare, but your cost sharing for each service will be different because it is set by the plan instead of by Medicare. Now, here are the features that are common to Medicare Advantage plans. First, most plans have a network of providers in your local area. Unlike a Medicare supplement plan, Medicare Advantage plans are offered by county or region, or in some cases by state, but they are not available everywhere. So if you live in a pretty remote rural area, there's a good chance that one plan might not even be available where you live, or if it is available, it might not be very competitive. The most popular of these is the Medicare HMO. Think of these as being like the plans you receive from your employer. You have an insurance company and you see doctors within that company's network. There is no coverage outside the network except in emergencies. Just like with the plan you received from your employer, you will need to choose a primary care physician, and you will most likely need to get a referral from your primary in order to see a specialist. Medicare PPO plans are also available and they offer more flexibility. But these plans do cost more, and your treatment you can go to outside the network at a higher cost. Second, you can purchase a Medicare Advantage plan that includes a Part D drug plan. These allow you to get your Medicare Part A, B, D services from the same insurance company. So you simply have one card instead of 3 different cards going to any kind of a medical service. Third, premiums for Medicare Advantage plans are lower than Medicare supplement plans. There are always exceptions to that. But in some areas, you may even find that Medicare Advantage plans have a 0 premium. That means that your plan does not charge you anything extra monthly to be a member of the plan. You must still, however, be enrolled in Medicare Parts A and B, and you will continue paying your Part B premium, but you won't have an additional premium on top of that. This does not mean, though, that the insurance is free. The insurance company is being paid by Medicare to administer your care. So Medicare no longer has to administer your care. Here are some of the additional costs you need to be aware of with Medicare Advantage plans. Premiums, if the plan you choose has one. Your Medicare Part B premium, you must continue to pay this. Most plans have deductibles, but they vary from plan to plan. Plans may charge deductibles for the drug plan only. Most plans charge copays for doctor visits, prescription drugs, like $5 or $10 or more. The amounts vary by the plan that you're in. Coinsurance. Plans may set coinsurance terms for certain services. It's a percentage that you would pay. Annual out-of-pocket maximum for 2021 is $7,550. However, if you live in a fairly populated area, the maximum is often considerably lower than that, up to 30% or more less than that figure. Fourth, Medicare Advantage plans offer ancillary benefits like comprehensive dental, vision, or hearing services. Some plans offer gym memberships as well. Now, recent legislation also allows Advantage plans to include things like home modifications for mobility, transportation to and from doctor visits, acupuncture, chiropractic care, podiatry services, meals, personal emergency response systems, diabetic supplies, funds to pay for over-the-counter healthcare supplies, even pest control, pet services, companion care. Now, these are for people that have qualified healthcare needs that are specific, and they offer those special services to those individuals. Now, it really doesn't mean that all plans will offer all these services, but they will at least be allowed to if you so desire to choose a plan like that. There are a few companies that are beginning to offer med subs with a few ancillary benefits as well, but these plans carry a higher premium than the traditional offerings by med subs. Fifth, Medicare Advantage plans can and do change their benefits from year to year. Now, I don't want you to think that this happens every year, but just be aware that it could happen. Much of this depends on how much the government is giving them each year and how much money they made the previous year. Are they going to continue a certain benefit or not? Think of this like your auto insurance company changing rates from year to year. So you may see some years where your costs go up and others where your costs go down, or benefits are added or benefits are taken away a little bit. This means you will need to review the coverage that you have each fall. We do that with each of our clients. You will get a letter called an ANOC letter for Annual Notice of Change. In the mail, it's going to be spelling out what this means to you, and you're going to decide whether you wish to keep your current plan or to change to another Medicare Advantage plan the next year. You don't have to re-enroll, only if you want to change plans. Be aware that if you enroll in a plan because you like a specific benefit, it's possible that the plan could drop that benefit the following year. So our advice is to always choose the plan that includes the healthcare benefits that are the most important to you, and to consider the rest as a bonus. Do you want a plan that will offer great coverage for a heart attack or a stroke or cancer or diabetes, or do you want a plan that offers a great gym membership? It's obvious. Sixth, some carriers offer specialized Medicare Advantage plans called C-SNPs that are created specifically for individuals with chronic special needs, such as diabetes, cardiovascular disease, or plans designed to work with patients that have Medicaid and Medi-Cal, known as D-SNP plans. If you fit into one of these categories, a plan like this may be a greater fit for you. It's not that a Medicare supplement plan or a Medicare Advantage plan is better than the other. They are different, and you need to be thoroughly reviewing all of the benefits of each plan to decide on what's right for you. Now that we have reviewed both types of plans, the next question is, how do you choose the best plan for you? Let's think about this choice in terms of coverage, cost, and convenience. Coverage. Provider choice is one of the main differences between these coverage options. Medicare supplement insurance gives you the freedom to choose from providers nationwide. Medicare Advantage plans have provider networks and serve a set geographic area. So ask yourself, do I need to travel outside my area to receive healthcare? Am I willing to change doctors if my doctor isn't in the plan's network? If keeping your existing provider is important to you, speak with your doctor and your hospitals and find out what plans are accepted there. Most doctor offices accept original Medicare, so you'll know that you can use any med sub plan if the doctor accepts Medicare. However, they may not be participating in a Medicare Advantage plan in your area. So if you have several providers that you don't want to be leaving, then check with them, make sure they are in the provider network for any Medicare Advantage plan that you are considering before enrolling in that plan. We help clients do that. Access to providers can be a big issue. Many of our clients who like med sub plans like the freedom of going anywhere they want to. If dealing with a network and the rules will drive you crazy, then you might want to just choose the flexibility of a Medicare supplement plan. Dental, hearing, and vision coverages are a big issue with some of our clients. If having a plan that includes those extra features is important, then a Medicare Advantage plan could be a better fit for you. Now, regarding costs, both options help manage your healthcare costs, but in very different ways. With a Medicare supplement plan, you pay higher premiums than you do with a Medicare Advantage plan, but other costs are lower. With an Advantage plan, you pay copays, but the premium is very low per month. You are protected by an out-of-pocket maximum for the year. So you have to ask yourself, do I use healthcare services very frequently or very seldom? Would I rather be paying a high premium even when I don't really use the services very often? Or would I rather pay copays and for when the services I do need? And what type of supplement insurance can I really afford? Make sure you keep your budget in mind. Sometimes we meet people who live on Social Security income only, or a very little pension or something on top of that. The cost of a med sup is simply not possible for them. Medicare Advantage plans can be a great option for people with a very limited budget. How often do you see the doctor? Since Medicare Advantage plans require copays when you see the doctor, you'll want to think about this carefully. Do you see a doctor multiple times a month? Will the copays cancel out any of the premium savings you're achieving by going with a Medicare Advantage plan? Med sub plans have very predictable costs. Medicare Advantage plans will be different every year depending on your usage. You will likely spend more in years where you have higher medical usage. Check the plan's out-of-pocket maximum limits and make sure you have a medical just-in-case fund with enough set in it to cover those costs. You'll also need to check the formulary of what your plan has as far as how the drugs go on a Medicare Advantage plan or with a Part D plan. If you miss the fact that your plan doesn't cover one of your important drugs or more expensive ones, this will create a real unnecessary out-of-pocket expense that will surprise you. So you want to check that before you continue to stay enrolled in a Medicare Part D plan within the plan you have. Convenience. People who opt for a supplement plan also buy a Part D plan most times. With original Medicare, that's 3 different plans. Many people don't realize this. That means 3 different insurance cards to carry and 3 different insurance companies to deal with when it comes to billing or problems with billing. With Advantage plan, it's just 1 card. So that's 1 convenience for that reason. So ask yourself, which coverage options is the best plan for my lifestyle? How do I feel about working with multiple insurance carriers? What Medicare Advantage plans are even offered where I live? And whether you choose a Medicare supplement insurance or Medicare Advantage, be sure to consider your needs and your budget and to compare plans before making a decision. Well, thanks for watching this video comparing Medicare supplement plans and Medicare Advantage plans. I hope you found it informative. You can check out our other videos to get more detailed information on the other parts of Medicare. If you have questions or would like to schedule a virtual chat with us, here's our contact information. We're independent insurance brokers, as I've mentioned. We specialize in Medicare. We have multiple carriers to choose from, unlike many of the advertisements we've seen online where the person's from really out of state and only offers a couple different Advantage plans options, even to compare with Med Subs. We offer the majority of all the ones that are most competitive in the California market and a few other states. Our service is always free to you, 100%. We've helped many people like you through this difficult decision-making process, and we'd love to help you. Thank you for taking your time to watch this video.